Um, this is awesome. Welcome everybody to the first edition of the Tech Docs Lunch Chat with the Hint team. My name is Dr. Brad Brown. We have Dr. Dave Cameron on, as well as G, who will be moderating this. We just a quick intro. We want to start this this Tech Docs Lunch Chat for various topics, sporadically, intermittently, regularly, all of the above. With myself and Dr. Cameron and G to go over some topics of what's happening, be in the know. Today we're going to discuss. We have a few questions. We have a lot we want to talk about, so we'll get to it. But I just want to say, anyone who's watching or listening, feel free to drop comments in the chat feature. Any questions? We want this to be as engaging as possible. Quick intro for myself. I'm a direct primary care doc here in the greater Denver area. I have a clinic, Strive Direct Health. It's a blast. I'm very biased, obviously, when it comes to DPC. And I also am the medical director for Hint Health, which has been a lot of fun as well. I will let Dr. Cameron introduce himself. He knows more about himself than I do, but he is fantastic, an absolute legend and leader in the space as well. Go ahead, Dr. Dave.
Great. Hey, thanks. Yeah, my name is David Cameron, and I'm the Chief Medical Officer at Hint Connect, and really excited to have a conversation today about looking at DPC in the employer space. And so, we've been in business now for over a year, and we're in well over 20 states, and we're planning on being in, hopefully G will probably be in all the states by the end of 2023. And we're excited to see what that looks like. And so this is just going to be a conversation today about where we're at now and talking about where we could be in the future.
Excellent. The future is exciting, if I do say so myself, definitely because of people like you. So G is the Senior Network Development Manager at Hint, correct? Did I say those words correctly in the right order?
Yes, thank you, Brad.
Good. And go ahead and introduce yourself a little bit.
Yeah, great to be here, everyone. I love that I get to moderate the kickoff session of these series, and I hope I do a good job and I get invited back. So a little bit of intro for the audience, if you find my job title a little bit confusing. Really being a Senior Network Development Manager at Hint means I'm just dedicated to building out and curating our very own DPC network, Hint Connect. So our focus in growing this network is to really create a mission-aligned community of DPC clinicians and make it easier for innovative plan sponsors and employers to offer that awesome DPC experience to anyone that wants them, right? Nice. So a little bit of my background. I come from public health, and honestly, for the last decade, I've consulted on provider performance management across insurance, healthcare IT, and provider groups. And looking back, I've worked with so many passionate clinicians looking to move the needle when it comes to the care delivery model. And I think really the direct primary care model is the way to make that happen. So glad to be here.
Nice. So before we get started, I know you have a bunch of questions you want to ask both of us. I want to ask you, I've had a lot of DPC docs ask, what is Hint Connect? Can you give us the one-liner or the elevator pitch, in 10 seconds of what you tell people for what is Hint Connect before we start diving into it? This is for you as well, Dr. Cameron.
I can answer that from my perspective. Hint Connect to me is essentially a zero-risk community that you can join to unlock employer-sponsored membership growth opportunities. That's how I see it. And Dave, what do you think?
Well, as a DPC doc, there's two things that make me nervous about starting up. I'm a DPC doc as well, but starting up a practice. The first is you have to run a practice. And it's hard to know what to do, how to hire staff, how to get a space, get all of the tech set up. There's just a challenge to know how to run a business. A lot of people don't want to run a business. So I think that's one of the pieces. I think the second one, and I think this is what Hint Connect is really designed to help DPC docs with, is how to mitigate the financial risk of starting up your own practice. In fee-for-service, you work for the hospital system, and day one, you're either an employed physician or you're opening up a shingle and you've got a whole lot of patients that are coming in the door. And so So there's not a concern about revenue. But when you start up a DPC practice from scratch, like what I did, I had 0 patients.
Dude.
And so you're like, oh my gosh, I've got money going out the door. I'm paying for my staff. I'm paying for the space and everything, and I'm losing money. How long is it going to be before I break even? And then how long is it going to be before I'm making the same amount that I was when I left working for the hospital? Mm-hmm. And so it's just scary. There's just two things that are fear-inducing. that are pretty significant obstacles. And so one of the things we're trying to do at Hint Connect is there a way that we can have a pipeline of patients that are coming from employers that are looking for DPC doctors? Mm-hmm. Is there a way that we can have like a national network of doctors that will be drawing employers so that they're going to say, hey, we want to find those DPC doctors. And so then they're going to be able to be eligible to go to any one of the DPC clinics. And so when people open up their new DPC, there's going to be patients that are going to be knocking on their door. And so that's our vision, is to be able to solve that second problem with Hint Connect.
Take one thing off the plate of us, DPC docs, I guess. I love it. That's fantastic. All right, G, I know you have a bunch of questions. We'll get to it. Go ahead.
All right. So I'd like to start our conversation today with some interesting stats. I think many of us in the audience are maybe data geeks. So according to the Kaiser Family Foundation, 156 million people, and that's roughly 49% of the country's population, receive their health benefits from employers. And today, over 52% of memberships flowing through Hint are sponsored by their employers. What are your thoughts on that? Brad, I'll have you start.
Sure. My initial reaction is I didn't realize so many of Hint's lives, if you will, were through employers, right? Yeah. As a DPC doc, we hear about Hint Health, and how they do a great job with membership management. I didn't realize that number was so high. So that was actually a really cool stat to hear. And then, basically 50% of people who live in this country get their health benefits through their employer is also a massive number as well. So my knee-jerk reaction is definitely, hey, there's definitely an opportunity for improvement on what is out there right now. I personally don't believe the healthcare system is broken per se. I think it is exactly what the people who built it want it to be. Very vague and not easy to navigate for the consumer, which is us. We're all consumers in the healthcare space. And so having that those numbers are pretty shocking, that there's a lot of room to be the change that we want to see, right? And that's what I'm trying to do in my clinic, but also with Hint and Hint Connect, of like, hey, this is we're sick of complaining about the system. Let's be the change. And so that was my first thought of, this is something that is really, really cool. I don't know, what do you think, Dr. Dave?
I was just thinking with my practice back through the pandemic. Before the pandemic hit, I had almost all of my patients that were in person. And then as soon as the pandemic hit, my volume in person dropped to about 5% of the visits, which is not unusual. But from a direct primary care standpoint, that didn't affect our bottom line because we already have the monthly membership coming in. But my colleagues that are in fee-for-service, they got hit hard. Their financials dropped dramatically. And so one of the things that we've done is monitor what's happened with employer growth with direct primary care and retail as well. And so during the pandemic, when we anticipated that all practices were going to be suffering, direct primary care practices grew. Mm-hmm. So the volume went up significantly. And actually, we tracked it with both retail and with employer. So during the pandemic, patients from employers went up 48%, and retail patients went up 25%. So it actually went up higher with the employers than with retail. So I actually think what this is telling us is that, one, there's significant opportunity with direct primary care, even in the midst of a pandemic. The second thing is that employers growing more rapidly than retail. And so I think as a movement with direct primary care, I think that we need to be aware of these trends and to be figuring out solutions to be able to harness that, so that we can be able to maximize direct primary care, so that this truly can be the status quo. This is what is the norm for for primary care across the nation.
Yeah. Sorry if I canned you before you hop in. Anecdotally, it makes sense, right? I mean, DPC is a product that sells itself pretty much from a consumer product standpoint. How often do you have someone come in and that you do a meet and greet and they're like, seriously, I could just text you? How awesome is that? Or like, I have direct access to you. This can't be real. For basically my coffee bill every month, I can have a doctor in my pocket. It's employers are now looking for something different. And so when they see that, it's a major benefit, right? The employers that I've talked to are like, this can't be real. I'm not going to sign up with you because this isn't real. And then they realize it is real. And it is a major benefit for their employees, and that helps their bottom line by retaining their talent, which I love. That makes me happy as well. Anyway.
Really well said. I have to say, before joining Hint Health, I always thought, right, DPC is great, but in my mind, it was really a phenomenal fit for smaller businesses. But really diving into our data, we are seeing that actually more than half of those memberships sponsored by the employer are coming from a company that's sponsoring more than 250 members at a time. So, we now know employer-sponsored DPC opportunity exists in various segments, and we're happy to explore that. So thank you both for that thoughtful discussion there. Now, I know we are definitely betting on employer-sponsored DPC to unlock growth, but let's dig a little bit deeper here, right? As we head into this really competitive labor market, with the staggering increases in healthcare costs that we're all probably experiencing, some may say this is the most opportune time to discuss DPC and its value to employers. Now, given your respective experiences, what are some challenges that you foresee clinicians may face? Brad, I'll have you start.
Sure. Challenges, this is obviously what I've experienced, what I've heard as well from others. One of my challenges is finding the decision maker, right? With an employer, whether that's a local lawn care company with their 10 people that do landscaping, or a company with 250 lives, 250 employees. Who can I talk to that would actually that would actually have the decision making power to say yay or nay to sign up with my practice, right? That's the hardest part. Second of all, I'm a doctor, not a salesman. I tell my patients that all the time. I say, hey, whether you sign up with me or not, we're still friends. I'm not going to give you the hard sell. I was trained in medicine, not in sales, even though I was a used car salesman in college, but that's a whole different story. But I don't want to go knock doors at local companies and say, hey, come sign up with my practices, or my practice. That's just not something that's something that I personally, and I've heard a few others, want taken off their plate, which is why Hint Connect is fantastic, to where that's kind of taken off their plate, right? To where, sure, they can still go do that for the small businesses that don't know about Hint Connect, but then you can always refer them to them to manage pretty much the contracts and manage the payments and everything, to where you, meaning the doctor, can stick to medicine pretty much. That's kind of my struggles with finding the right people.
Yeah. Sometimes I think the persistence factor is tough, because oftentimes the first conversation may lead to some intrigue, and then you end up having a second conversation, which might be leading to the right person. But oftentimes there's multiple decision makers. Sometimes unions are involved. Sometimes the CFO, there's an HR director, and sometimes it's hard to figure out who that person is. But one of the things, I found is that sometimes not necessarily starting off with the whole employer can be helpful. Starting with just a few people. I've had, sometimes you end up having the CEO and their family as patients, and they realize the value quickly, especially when there's a issue at 11 o'clock at night and they call and then they get an answer and don't have to go to the emergency room. It's a really powerful. Actually, I had one CEO. It was a Saturday, and their 6-month-old came in with just vomiting and diarrhea. Just, a quick visit
Peace of
was
mind.
ran, and the kid turned around and did marvelously. And honestly, I could do no wrong from there on out. And now, I am just getting one after another of their employees coming in. So it's just interesting. So I think persistence has been really helpful. Knowing who to go after to identify the right size, the right culture, trying to identify the right employers that are a good fit for the practice. Lauren Tancredi with Hint Health does a great job with her accelerator program. There is a playbook, and I don't know, G, are you going to show a link to the playbook that helps DPCs to be able to have all of the tools in their tool belt for being able to engage employers? That'd be really helpful for them to have that link.
Yeah, the playbook is readily accessible. If you use Hint, you navigate to the help button, and it's in the drop down. But we can certainly send that out to folks in the audience after this as well.
We have a question that came in from LinkedIn. Did you see that one? It's from Andrea. She said, "Are you seeing employers replace their traditional health benefits with DPC?" I don't know. What do you guys think?
So I do. I see employers that are paying a lot. I mean, it's usually the number 2 expense for most employers, and they feel like they're not getting a great value. It feels kind of like it's kind of like the expensive golf membership, right? You end up having to pay, $30,000 a year, and then that gives you the privilege to pay a monthly fee, and then to have to pay for food and everything. It's kind of like the same thing with healthcare. Like, you pay a lot, and then there's a $7,000 deductible, and then there's a co-insurance, and then there's an out-of-pocket max. It's like, what's the value that I'm getting here? And so a lot of employers are starting to realize, like, well, gosh, 90% of all of our healthcare needs are taken care of by the direct primary care, and then we just need to have some other wraparound for the hospital, for the expensive stuff, and we don't have to pay nearly as much when we're going with the typical expensive insurance plan.
Love it.
Yeah, and if I can just chime in here, Andrea, I think your question is a great one, right? And to really bring this into conversation, a lot of the times it's really 2 main stakeholders that we're trying to educate about the existence of DPC. One is the employer, certainly the C-suite, the decision makers, and 2 really is their benefit advisor and brokers. And just to let you know, at Hint, we've attended several conferences. We try to keep in touch with the community. And just this summer, I went to the Benefits Broker Expo, which is the biggest event in the space. And actually, the broker that won Broker of the Year award is a DPC-friendly advisor. So, we are seeing DPC gaining momentum in that space. And really, they're motivated to bring innovative solutions to their book of business in order to help save cost and offer a much more optimal experience.
Nice.
I think we might have lost Dave for a second, but hopefully he can jump on.
I guess. Yeah.
Yeah. All right. So, there he is.
Sorry, I got kicked off.
No worries at all. And what do you guys think about the sales cycle when it comes to approaching local employers? What does that look like for you?
Go ahead, Dr. Dave.
Yeah.
Sorry, I missed a little bit of the question. So we're talking about the sales cycle for employers.
Yeah.
It's long. It's long. So most of the time it's over 12 months. And it really depends on the size, whether there is a municipality, if there's a union involved. Oftentimes, I always anticipate that I need to have about 7 or 8 contact points. And I always start off with curiosity. I target the employers that I want to go after, but I really want to know what their problems are. What are their pain points? What is it that they're looking for? And seeing if that's something that I think direct primary care can help a lot of organizations, but I also want to make sure we got a good partnership. If direct primary care, if they don't truly understand the value of direct primary care, and if that doesn't fit into their long-term vision, then maybe that's not going to be a great partner. But I first anticipate that I need to do some learning and identifying what are the things they're really looking for. Are they looking for value? Are they looking for the direct primary care experience? Do they want to see if they can save? If they are a self-funded plan, are they wanting to be able to capture the costs through a DPC to avoid the downstream expensive spends at the hospital through specialty care and such? And I fully anticipate that there's going to be some hiccups along the way. I think and then also to anticipate that we're not going to get everyone. Shotgun approach and anticipate that you're going to try to be able to capture a few, but that you're not going to be able to go after all of them. Now, hopefully, my vision is that direct primary care through Hint Connect will make it a lot easier on us, because it's hard. This is hard work, and I don't think that most people are up to going after every employer. It's hard work, and you kind of need to get out of an extroverted self to do it. And I think some people have no desire to go after employers, and hopefully Hint Connect will be that organization to be able to bring those employer lives in that they might not be able to get themselves.
And to add on to that, actually, Dr. Dave, I've the feeling I've gotten from myself too, this is, opening up a little bit, the fear of hearing no, right? Because obviously we love our clinics. We think we're the greatest thing since sliced bread. And of course we can solve all your problems. And you mentioned hiccups. You can say, oh, well, I'll treat your hiccups along the way type of thing, But us doctors, we're high achievers, and hearing no is, we usually just find a way around that no until we get what we want. But that doesn't really work in this space, And so hearing no is that fear of almost failure is like, oh, well, I don't want to hear that. I've heard a couple docs as well as myself say that, like, well, I want to go just see patients. Like you said, it's a big lift, and it's that persistent effort that's required, which no one is afraid of hard work, but there's a lot of hard work that needs to go on. And that's just one piece that if we can, we being Hint Connect can remove that piece of the hard work, it's a major value add and a win-win-win across the board. Yeah.
I actually have a lot of colleagues that would love to go to direct primary care, but I think that this is another one of those obstacles that they don't want to do. They're afraid of building a practice and afraid of what that looks like, and trying to bring in businesses, and feel like that's not their skill set. And if there's some ways in which we can be able to have those addressed, then I think some of our colleagues may join us. I'm looking forward to having more and more of our colleagues that are not the business savvy types, the ones that don't want to run their own business, the ones that kind of want to have things set up for them, and not have to build relationships and have contracts with employers, so that they can still practice in the DPC model, but not necessarily have to be business folks in order to do so.
And save them from the burnout and moral injury, right?
Yeah.
Actually treat patients instead of retiring 20 years early. That's another discussion for another day. Sorry.
That'll be for January of 2023. So really good discussion here. One thing that I'll add, based on the conversations that I've had to date with hundreds of DPC clinicians now, the longer sales cycle, the elevator pitch, right? All of that is just half of the burden and complexity. Really, once that contract is signed, sometimes clinicians let me know they're really disappointed to see maybe only 10 to 20% of the eligible employees actually end up signing up with their practice, right? So that's where we realize really comprehensive and repeated DPC education, pre-enrollment, during enrollment, and after enrollment is so important, because, it's human nature to essentially resist or be fearful of change, right? And especially when it comes to healthcare benefits. So it's really important that any way we can take this on for our clinicians, and to really ensure there is a successful benefit launch is what we'd like to do. Let me take a quick peek to see if there are questions coming from the audience there. I think right now, not yet, but feel free to enter them. As we dived into this a little bit already, but let's actually zero in on what are some ways that HINT can actually support DPCs that want to work with employers. I'll start with you on this one, Dave.
I'm sorry, I was reading this other one down here. Large corporations that are not self-funded aren't interested in spending more company healthcare dollars outside of the traditional health insurance plans add on DPC. Is it okay if I answer this one right here? This is kind of I think this is a very interesting question, because those that are self-funded, DPCs can help them save money, because the DPC is a fixed fee, and if you capture as much of the healthcare spend in the DPC, then there's going to be less downstream on unnecessary hospitalizations, unnecessary radiology studies. Now, what about those that are fully funded or level funded? So if the DPC does a great job, it helps the insurance company save money, right? And the insurance company may or may not pass that savings on to the employer. So I think this is Bruce Jung. I think Bruce has a really good point. And so that's why we're starting to partner with some payers. Is that okay if I say some of the names out there, G, or should I hold off on that?
Maybe let's not.
So anyways, Bruce, so there are some payers and TPAs that are out there that are putting together plans around direct primary care, which is really exciting. And they're less expensive than going with a fully funded plan that's through one of the standard plans. And so one of the things that's exciting is that these TPAs are realizing that DPCs save money. It costs less. And so as a result, it's this new DPC package with a TPA that is built around the DPC has a lower premium than with traditional insurance.
And that goes into Dr. Jamal's question right here as well. Are you seeing any growth in MSOs networks within the community as an approach to acquiring employer groups, or is it mostly individual docs, right? Dr. Jamal is a fantastic physician, even better human, by the way, if I can give him a shameless shout out. But what do you think about that, Dr. Dave?
So MSOs and networks within the community is an approach to acquire employer groups. So absolutely, I think that is really the goal of HINT Connect, is that we're forming a network across the country to be able to target employers that will not be able to. So most DPCs and networks that are currently available cannot go after really large employers because they don't have the geography. Mm-hmm. And so if we can get a large enough network of us, then we can go after some larger employers together. My practice by itself, I'm not going to be able to go after a large employer. Dr. Brad's not going to be able to go after a large employer. But if you get enough of us together, we can go after a large employer and then be able to see all the patients together. And our whole goal is to see if we can partner together and have this make sense.
And change the American healthcare system. Yes.
Yeah.
Definitely. And just to expand upon that as well. So first of all, hello, Dr. Lawrence. I think we've chatted before. We absolutely are seeing significantly more growth in networks. In fact, in our DPC trends report, we've seen practices that are part of a network are seeing 5x, times the amount of growth compared to practices that are not affiliated with a network. That's part of the reason why we, essentially hypothesized that something like HINT Connect will be well received in the community. But at the same time, we are not trying to compete with existing networks, right? We actually are welcoming and have large networks that are joining HINT Connect already. So for example, we have our great partners in Oklahoma, Primary Health Partners. We're partnering with Nextera, with Dr. Flanagan, and so on and so forth. So I think really at the end of the day, we have the same goal, right, is to be able to unlock and serve as many members as possible. And if geography coverage is the limiting factor, curating the first of its kind nationwide network is probably the way to solve that. So thank you for that question.
And I saw another question earlier that said, what are the obstacles for employers from adopting DPC? I just think there's fear. This is healthcare is very expensive. And if people make a mistake, their jobs could be on the line. So I think a lot of HR directors don't want to make a mistake. Just think they're like, no, I'd rather stay with a lousy product and not lose my job. But I think that there's some other things. I think that it's complicated for them to figure out what to do. So oftentimes, if they want to go with DPC, they also sometimes have to figure out, well, what do we do for hospitalization? What do we do for specialty care? What about for radiology, for MRIs? And so it gets complicated. And what I'd love to see is to have a single easy button where it's like, hey, you have an easy button that we know that they're going to be able to cut their costs and to be able to get a great product. And I think when we are able to do that, when we've got partnerships where we can say, hey, here is a product that has DPC at the center with coverage wrapped around, and employers can purchase that as a single entity, then it will make it so much easier for them to adopt it without the fear that they're going to be making a mistake or losing a lot of money with their number 2 expense.
Absolutely. We're seeing another question come through from Bruce. How do we position ourselves or DPC in relation to companies having their own on-site clinics? Any thoughts there?
Well, I think that's an interesting question. So there's some large DPC value-based care organizations that are out there, and they've got their own brick and mortar. Some of them are near sites, some of them are on sites. And some of them are in quite a few states now. And some of them will have different strategies. Some of them will have an all-in model. So where they will say, everybody that is at let's say they sign up a certain employer, and then immediately all of the dependents, everybody on the benefit plan is going to be a patient. And so that's a very common model with some of these organizations. The problem with that is that it ends up changing the incentives. Instead of direct primary care doctors saying, hey, come on in, we want to take really good care of you, it leads to a mindset, please stay away. It's almost like the gym. We can't have everybody here at the same time because we don't have enough space for all of you. So I think the whole goal of kind of the direct primary care movement is to, 1, have small patient panels, to 2, to do wonderful service, 24/7 access, and to make sure that anybody that needs care gets care. So we're preventing them from going to the emergency room unnecessarily. I'm worried about some of the other organizations that have changed their incentives to try to keep patients away. I believe that it might be easier to attract some employers for the short term, but I think that our long-term strategy in the larger DPC movement is one where I think it's built for success. I don't know, Dr. Brad, what are your thoughts?
Well, I think you nailed it when you on the vein of incentives, right? Aligning the incentives to where it's the same fee for service versus DPC, right? I know we shouldn't pit them against each other, but we do anyway. The fee for service incentives for the doctor are different than in DPC, to where in the fee for service world, you need to see people in person to generate the revenue, right? And so there's almost a financial incentive to see your patients, whereas in DPC, there's no financial incentive at all to see patients. I can see as much or as little as you want. It's the same idea, it's with the on-site clinics is I'm incentivized, like you said, to not see you because A, my day is easier, B, there's so many people here anyway. We like the gym analogy is fantastic. We just can't see you. And then what good does an on-site clinic do if you're chock full of 40 patients in a day and there's still 200 waiting to be seen,
Yeah.
And so that was a great question by by Bruce. But yeah, it's all, I love the incentive side of things. So just aligning, getting everyone on the right incentives.
Brandy keeps on putting these great points here. She's talking about the ease of showing up and really the whole concept of advocacy. One, direct primary care does that great. I mean, we've got 24/7 access by in-person visit. It's easy to get a same day, next day visit, plus the after hours access, which is really amazing. And it's shocking when patients get their doctor on the phone, like on a Saturday night. But the other thing, I think, Brandy, that you nailed is the advocacy. Is how do you be a good shopper? When I used to work for fee for service, I had no idea how much it costs when I wrote for an MRI. I just say, oh, here you go. Insurance will cover it. And I didn't know which of the cardiologists or orthopedic surgeons were the right one. And once I became a direct primary care doctor and it became important to the consumer and to the employer, I started to realize that the orthopedic surgeon that I'm going to refer to is the one that operates at an ambulatory surgical center, because it's less than half the cost for both the employer and or the patient. And a lot of times, for prescriptions, I just write prescriptions, and now I'm like, okay, how can I help this person save money? I mean, am I gonna, go to, which pharmacy? Am I gonna use GoodRx? Am I gonna use Simple Care, or who's the Dallas Mavericks? Dallas Mavericks. So, Cuban pharmacy. I sent a lot of people there, and I just think that patients need that advocate, and I think direct primary care is perfect for that. We're that advocate, and I think if we can continue to grow, I think patients are going to want that level of advocacy so that we can be able to help our patients to be able to find how to be good shoppers, to be good consumers, and then to also that will save finances downstream for our whole system, whoever ends up paying for it.
Thank you for that. Just keep an eye on time here. I want to make sure we get to, at the end of the day, we've heard the challenges, right? The complexities. And certainly, I think a lot of folks in the audience are still wanting to explore and work with employer contracts. Now, what can we do at Hint to maybe alleviate some of this burden? So part of that is certainly our DPC network, Hint Connect. I know both of you have joined the network. So I'll start with you, Brad, since you joined well before the Hint and Arrow acquisition. What was your experience like, and what was the reasoning behind joining Hint Connect?
I mean, that's a great question. Honestly, the reasoning was I saw the value in it for me personally to be a part of this network. And you pitched it great as well, G, way back when we spoke about this. My whole thing personally, I want to change American healthcare system, right? We all do. I'm tired of complaining about it. So being the change that I want to see, and then joining the Hint Connect side of things as well as the Nextera side of things, to where being available for people who might not have been able to find my tiny little clinic here in Erie, Colorado on their own, broadening my ability to change their world, right? Change the patient's world. I'm not going to go out and change the world on my own, but I can change the world for each individual patient, right? And so my experience with Hint Connect was, my thought process was, hey, I'm still an independent practice, right? I'm still Strive Direct Health. I'm Dr. Brad, and there's Dr. Sarah in the next room. And we're not tied down to, have to do certain things contractually or anything like that, right? I'm still a doctor. I'm still the owner of the practice, and being a part of Hint Connect opens up the doors to where, hey, I can help serve more lives. I can help be there for people, whether that's a small piece of a company that's here in this area or nationwide, whatever it is. And so I fully supported it before I even, joined the Hint family. That's totally a different conversation as well. But yeah, that was kind of my experience. And it sold itself, right? All of my pain points with finding employers seem to be, or are relieved with Hint Connect. And it was a no-brainer for me.
Thank you for that. I do think, the fact that Hint Connect is designed to respect clinician autonomy really goes a long way in my conversations with clinicians. Now, what about you, Dave? You've also joined Hint Connect. What's your journey like?
Yeah, well, for me, it was a couple of things. One is that I want to make sure that I've got autonomy as a DPC. I left fee-for-service for a reason, because I did not want to be owned by the insurance company and to be told how to practice. I did not want to have an employer telling me how many patients to see every day. And so I like the fact that I can set my own rates, that it's non-exclusive, that I can still practice the exact same way, and all it's doing is sending patients my way. And I do give a discount for Hint Connect because I do know that I'm not having to pay for marketing for so I give a 10% discount off of my fee for that, and I'm hoping that will attract enough people. I mean, Hint Connect is a marketplace, so employers can pick me, or they can pick anybody based on the services and the price. It's just a marketplace. Mm-hmm. But my thought is I think we're offering great value, and I think we're trying to set it up in a way that helps Dr. Brad, myself, and all of us other DPC to be able to continue to practice the way we envisioned direct primary care when we started.
Precisely.
Absolutely. You know, I have to say, I'm not sure if we touched upon this earlier, but one of the other aspects of joining Hint Connect is we drastically reduce your contracting complexity, right? I think most clinicians don't want to be spending their hours reading through contracts for every single employer. And certainly the employer's HR team don't have the expertise nor the time to be directly contracting with multiple practices. And by joining Hint Connect, we take that on for you, and you just have to have one contract with us. And behind the scenes, we're really facilitating, right, the services, the demand, and bringing clinicians and employers to the same table. I did get a warning from Alex that we are a little bit over time. I'd like to end this with one last question to you both. You know, what are you excited about for 2023 when it comes to direct primary care? I'll start with you, Dave.
Gosh, what a great question. I'm not quite sure. I think for me, this is going to be a year where I think we're probably going to start tapping into larger employers. I think larger employers, and it'll be curious to see what happens with the economy. I'm not sure where things are going to go. Inflation's already been a big issue. The probable likely recession that's going to come into play next year, I think, is going to make a lot of employers think through, like, okay, where can we cut some costs? And I think that we might have some opportunities. I think direct primary care is positioned to help the triple aim, which is cost, quality, and customer satisfaction. And we have clearly delivered on that for years. There's data, there's the Milliman stuff. I mean, we've got all kinds of data that I think that it is out there. And I believe that more employers are going to realize that there's value and cost savings when you add a DPC benefit. And I think particularly with more self-funded large employers. So that's my prediction. Don't hold me to it, but that's my thought.
I wrote it down, Dr. Dave, so I'm good this time next year.
It's in the ether now.
Yeah, I'll piggyback off that. I think, obviously, I'm very biased, like I've said a million times today. DPC is the way of the future. It's a product that sells itself. Hint Connect is the same way. It's clear that this is a win-win for everyone involved. I'm excited to see where it goes. It's only going to take off like a rocket, and it's going to be fun to be, a small piece of it.
All right. Well, thank you both for your time today, and thank you to the audience. Have a great one.
Awesome. Until next time.
Yes.
Bye-bye.